quiz to commemorate World Stroke Day, which is celebrated on 29th of October. And this year's theme of World Stroke Day is Together We Are Greater Than Stroke. Let us
Let us open this Neuro Quest with some fun facts. I'm sure you know that our brain weighs around 3 pounds with the texture of firm jelly-like. And unlike what movies make us believe, we surely use more than 10% of our brains.
I, Dr. Gargi Pore from Department of Neurology.
And I, Kritika Agarwal, intern at Bharti Hospital.
Together we will guide you through this intellectual adventure.
To commence this event, I'd like to call on stage Brigadier Dr. S.P. Gorthi Sir, Professor and Head of Department of Neurology at Bharti Hospital, and Dr. Supriya Barsode Ma'am, Professor and Head of Department Medicine, Bharti Hospital.
We are honored to have a few dignitaries among us today. I'd like to request Dr. Mandar Karmarkar Sir, Principal of Bharti Vidyapit Medical College and Professor of Forensic Medicine, to please join us on the stage. Now I'd like to request I'd like to call our chief guest for the day, Dr. Anand Alurkar Sir, President of Indian Stroke Association, and our second judge, Dr. Sripat Pujari Sir, Treasurer, Neurology Society of Pune, to please join us on stage.
Now, as is tradition, we will proceed with the lighting of lamp to begin the event auspiciously. Light is the universal symbol of prosperity, positivity, and wisdom. We welcome the warm, bright glow of Diya to wash over us as we embark on this quest for knowledge.
I'd like to request the dignitaries to please rise and come together for lighting of lamp and then resume their seats on stage.
Thank you, dignitaries. We would be honored to facilitate them and request if they would each say a few words of encouragement for our participants and then resume their seats in the audience.
I would like to request Dr. S.P. Gorthi Sir to felicitate Dr. Karmarkar Sir. Thank you, sir. Next, I'd like to request Dr. Barsode Ma'am to felicitate Dr. Anand Alurkar Sir. Thank you, sir. I'd like to request Dr. Gorthi Sir to felicitate Dr. Pujari Sir. Thank you so much, sir. I'd like to request Dr. Karmarkar Sir, Principal Bharti Hospital, to please address the participants.
I welcome the chief guest, Dr. Anand Alurkar, President, Indian Stroke Association, and Dr. Sripat Pujari, Treasurer, Neurological Society of Pune. On behalf of Bharti Vidyapit and Bharti Vidyapit Deemed University Medical College, I welcome both of them for this Neuro Quest quiz. And I welcome all the participants. I think there are 7 teams. I won't take time. All the best to you. and may the best win. Thank you.
Thank you, sir. Next, I'd like to call our chief guest, Dr. Anand Alurkar, sir, to please say a few words of encouragement for our participants.
Thank you, Dr. Gorti, for having me here. It's always so wonderful to be among students. I was here a few years back when the first stroke quiz was held, I think. And as you all know, stroke is a very, very important problem for all of us. Not only for its ability to cause death and disability, but also it has a huge socioeconomic burden on the society. About 50% of stroke patients remain disabled after the event. And this figure can drop to around 25%, and the mortality can also drop by 50% if the recent advances that have taken place in the last decade or so in the treatment, the patient avails of it. But there is a huge treatment gap, as we all know. Most of the patients do not reach us in time to avail of these new treatments. So it is extremely important that all of you, whether you do neurology or not in your future career, should be aware of strokes, how to diagnose a stroke. Recently in the sense, we at least once a week, me and Shripad, we encounter a situation where a person has had a TIA, the patient has gone to a general practitioner or even a physician, MD physician, and the problem has been neglected, saying that it might be because of general weakness, it might be because of lack of sleep, stress, etc. And the patient has then landed up with us with a major stroke. This is a very, very, very common situation in practice. So I hope all of you, even whether you become neurophysicians or not, are able to diagnose TIAs and stroke so that all our patients avail of the best possible treatment that science has to offer. Thank you, and all the best for the quiz. Thank you very much.
Thank you for those encouraging words, sir. I'd like to call on stage Dr. Shripad Pujari, sir, for a few words.
Thank you, Dr. Gorthi and Bharati Vidyapeeth College for having me as a judge here. And I have been here last couple of times, and it has been very interesting and enjoying. And I echo Dr. Alurkar's words. We all must know about stroke. Like as he said, you could encounter a scenario where your neighbor comes to you, whatever specialist you are, who may come to you with some symptoms. He describes a stroke. You should at least have the ability to identify the basic symptoms of stroke so that you can guide that patient and family to the right emergency, so that he receives the most advanced treatment. As you know, in the last 2 decades, there has been a revolution in the form of intravenous as well as mechanical procedures with stroke. And the other part is, it's a very good initiative, excellent initiative by Dr. Gorthi to encourage and motivate the medical students to learn about neurology and stroke, so that more of you can develop interest in and take up neurology as their career. As you know, we are just around 2,500 neurologists in India with a population of 140 billion. The ratio is extremely skew as compared to West. That's all I wanted to say. Thank you.
Thank you so much, sir. We are honored to have you among us today. I'd like to request Dr. Gadkari, sir, to explain the rules of quiz.
Thank you, Dr. Gargi. Good afternoon, respected seniors, dear colleagues and dear students. It really gives me great pleasure to welcome all of you to the second edition of this prestigious intercollegiate quiz for undergraduate in neurology, which is jointly being hosted by the Department of Medicine and Department of Neurology. We are really honored to have such distinguished guests with us here today. Sir, your esteemed presence is going to make this event a grand success. First of all, I would like to thank Dr. Mandar Karmarkar, sir, Principal of our Bharati Medical College, for being a beacon of guidance. We are really grateful for his unwavering support in this academic pursuit. I would also like to thank Dr. Anand Alurkar sir, President of Indian Stroke Association, and Dr. Sripat Pujari sir, who is the Treasurer of Neurological Society of Pune, who have kindly and graciously accepted our invite and help us conduct this quiz and judge it. So we are very thankful for your presence over here, sir. I would also like to thank the Head of the Department of Medicine, Dr. Supriya Barsode Madam, and Head of the Department of Neurology and Quiz Masters of today's quiz, Brigadier Dr. S.P. Gorthi sir, who has been instrumental in envisaging this concept and leading from the front to organize it. It is really due to the enthusiasm, passion and perseverance of Gorthi sir that we all are present here before you with this exciting event. I would also like to thank all seniors in our department, colleagues, residents and support staff and our dear interns of both the departments for their immense contribution to make this quiz possible. I would also like to thank head of the departments of all prestigious medical colleges who have kindly allowed their students to participate in this medical quiz and to make it really a great intercollegiate quiz. I also want to thank all the participants for their enthusiasm, passion, and I would like to thank the entire faculty in the audience and students for coming to attend this quiz. I am sure it will be an academic feast for all of you and stimulate your young minds to study the subject of medicine and neurology further. Special thanks to Boehringer Pharma for sponsoring this event third time in a row. Your continued support is well appreciated. Now I would like request all dignitaries to please take their seat and I would like to formally announce the opening of the quiz. Thank you. The laptop, Gargi. After the elimination round of 50 MCQs which was done, and believe me, they were quite tough MCQs, I myself did not know even half of them. So the first team to join us on the stage is team from last year champion team, that is BJMC. I would request the team BJMC to please come and join us on table E. Secondly, I would request team Symbiosis, Sakshi and Krishna to join us on team G. Now I would request team SK and MC to please join us on the stage at the position team D. I would request AFMC's first team, Meghna and Sakshi, to please join as team F. I would request team Mimer, Aparna and Sakshi to join us here as team A. I would request our own home team, Bharati Vidyapit Medical College, Dr. Anish and Advait to please join us here as team B. And I would request Rubika and Celine from AFMC Medical College to join as team C. Rubika and Celine. Just call AFMC. Call your other one. So as you all know, this quiz is going to be played into 4 rounds, and the first round is going to be called as the stroke round because this quiz is held in the commemoration of World Stroke Day, and therefore it is apt that the first round will be called as the stroke round. Now the rules for this round participants are quite simple. There will be around 4 questions per team, which will be a single best response type of question. Each correct answer is going to give you 10 marks. There is no negative marking. So I request every one of you to at least attempt. If you are not able to answer the question correctly, the question will pass on to audience. Audience can raise their hand. We will ask the answer. Whoever gives the correct answer will get something exciting from here. So I would request Dr. Gorthi sir to start with the quiz, please. They are coming, okay. Team AFMC is yet to join us as Team C. Team C, where are you? Please come in. Where did you go? Should sit. Team C, please sit there. I already told them, but I would tell Dr. Gurthi sir is preparing with his slides. I would request all the teams to introduce themselves to the crowd. Please introduce yourself, Team A.
We are from Maimar Medical College, Sakshi Jaram and Aparna Vahegaonkar.
Hello, we are Team A from Maimar Medical College. My name is Aparna Vahegaonkar,
And my name is Sakshi Jaram.
and we are Team A.
Good evening. Sorry. We are Team B. I am Advait and I am having Anish with me. And we are Team B.
Why it's not open?
Check. This is Rupika Pilav and Celine Rafael from Team A.
We are Team D. My name is Ishan Fane.
Myself Kirti Dore.
Myself Shifa Sheikh.
And we are from BJMC.
Control Alt Del. Task Manager. Okay. Enters. नहीं आ रहे हैं क्या करूँ it's not going ये प्रोजेक्ट करना projection
Check.
Check.
hey question like that yes okay okay yes go ahead the question starts from team A. Yes, sir. Right. So, as again I repeat, 4 questions per team. The single best response type question. Each correct answer 10 points, no negative marking. The question passes to audience if it is not answered. Okay.
Hello.
Take 1 minute or 2 minutes. Okay. It's not coming, no? Something wrong with this. Okay, it's not moving here. Okay, we'll read from there only. First question is about the image. Which of the following characteristics of acute stroke increases likelihood that stroke will not be visualized on the DW image also
of a brain MRI. Usually, as I told you, MRI brain picks up all the one of the locations. It's very difficult to pick up. Team A, your time starts. Huh? Wrong with this. Okay, doesn't matter. We'll cancel this question, but the answer is brainstem. Okay, right. Team A, you will get a second chance. This is about blood supply to the brain. Okay. The lenticulostriate branches provide blood supply to all of the following structures except one of them. 45 seconds.
Thalamus.
Yeah, correct answer. Thank you. The scorers, take a note. Correct answer. The team B. Secondary stroke prevention, the question is about that. A 74-year-old right-handed man awoke 3 days ago with non-fluent verbal output, that is Broca's aphasia, mild weakness of right arm, right side of the face. His deficits have not improved or gotten worse since then. He initially insisted that the symptoms would resolve on their own, just as they had in the past, but when he still had trouble lifting things, he agreed to seek medical attention. Imaging of which of the following arteries is a class 1 recommendation of the American Heart Association and American Stroke Association? Extracranial internal carotid, extracranial vertebral, intracranial internal carotid, intracranial vertebral, and middle cerebral artery. Just understand the question correctly.
The middle cerebral artery.
We have to ask the audience in between, sorry, but that the answer is wrong. Okay, it is external, extracranial, internal carotid artery. Okay, next.
This is question to team C on cardioembolic strokes. Paroxysmal atrial fibrillation must be detected within what time period after a stroke for the benefits of anticoagulation to outweigh the risks
Of recurrent stroke.
of recurrent stroke? 3 weeks, 3 months, 1 year, 3 years, or unknown?
We would like to go with 3 months. 3 months.
The answer is it's not known. The likelihood of detecting paroxysmal atrial fibrillation after a stroke increases with increasing duration of cardiac rhythm monitoring. But it is not known how frequently atrial fibrillation will occur to benefit the anticoagulation, which will outweigh the risks of bleeding. Question to team D on TIAs. 65-year-old patient with diabetes presents with a TIA. According to the ABCD2 score that assesses stroke risk for someone with TIA, which of the following is not used as a predictor of occurrence of a stroke? 1. Diabetes, age more than 60 years, hypertension, duration of neurological symptoms, or dyslipidemia. The correct answer, 10 marks to Team D. Hyperlipidemia is not part of the ABCD2 scoring. ABCD2 gives a risk for strokes after a TIA. Points for risk factors are age more than 60 years, 1, BP more than 140 by 90, 1, clinical features, 1 point for speech impairment without weakness, 2 points for focal weakness, duration of symptom, 1 point for 10 to 59 minutes, 2 points more than 60 minutes, diabetes, 1 point. With a 2-day risk of stroke, 0% if the score is 0 to 1, 1.3% if it's 2 to 3, 4.1% if it's 4 to 5, and 8.1% if it is 6 to 7.
Now the turn of pediatric stroke, right? Let's see what is in store for E, no? Group E, okay. Children with sickle cell disease should be routinely screened using which of the following imaging modalities? Catheter angiography, CT angiography, magnetic resonance angiography, transcranial Doppler, transesophageal echocardiography. Which one you would like? The team E?
Transcranial Doppler.
Excellent result. I give them big claps. Children with sickle cell disease should be routinely screened with transcranial Doppler. Elevated middle cerebral artery velocities can identify the children at greatest risk for stroke, who should be treated with exchange transfusions that can dramatically reduce their risk of stroke. That's a learning point. Stroke localization question next to team F. A 42-year-old woman with diabetes, hypertension, hyperlipidemia brought to emergency department for unresponsiveness. An MRI was obtained and is shown in figure. Which of the following will most likely be encountered in this patient? Is it vertical gaze impairment, hemisensory symptoms, hemiparesis, quadriplegia with impaired horizontal gaze, and aphasia? I'm sorry. Oh, I'm sorry. This is not vertical gaze, it is quadrilateral. Sorry for the audience next time. MRI shows restricted diffusion and DWI involving the pons as well as cerebellum. Quadriplegia and impaired horizontal gaze findings consistent with lock-in syndrome is the correct answer.
The lesion is in the pons, which holds the PPRF, which controls the horizontal gaze in the mid.
Question to team G about acute strokes. A 58-year-old woman with multiple vascular risk factors presents to the emergency department 1 hour after onset of left-sided weakness. Her National Institute of Health Stroke Scale NIHS score is 0. Which of the following deficits would not have been measured during the NIHS testing could be indicative for IV thrombolysis in this patient?
I would like to emphasize, though NIHS score is 0, which particular deficit will make us give it thrombolytic therapy? Okay, that you have to identify, which will have a bearing.
Dysarthria, hand weakness, hemispatial neglect, limb ataxia, or sensory loss?
Would not have been measured. That would not have been measured.
C. Hemispatial neglect.
Audience?
Anyone from the audience?
Judges have a free say. If you don't like the question, we can change. You can anytime. We have questions in store. If you don't think that. Disclose answer. Hand weakness.
Hand weakness. Although patients with acute ischemic stroke with low NIHS will usually recover without thrombolysis, such patients should be assessed for the presence of disabling deficit that would warrant thrombolytic treatment. So this deficit is not measured by NIHS as such, is hand weakness.
Weakness is measured upper limb, but not hand grip weakness. That's what you should know about NHS. The hand grip is not measured, it's only limb, right? So that's the point.
Team A, a 49-year-old man with history of hypertension presents to the emergency department with acute onset of right hemiparesis and aphasia. The time he was last seen normal was about 45 minutes prior to arrival. NIHS score is 14. Which of the following is the best next step? Start IV TPA, get a brain CT scan, give aspirin 350 mg once, start IV heparin, get a brain MRI.
Get a brain CT scan.
I think that's the correct answer.
Yes, yeah, that's the correct. The patient presents with an acute stroke, and if this is an acute ischemic stroke and there are no contraindications, IV TPA can be given. But we need to know whether it's an acute ischemic stroke or it's a hemorrhagic stroke.
Can I ask a supplementary question?
Yes, yes.
Apart from plain CT scan, what else will you do simultaneously?
You can answer. What else you would like to do? Excellent.
Also visualize any defect or the location of the
Why specifically in this patient?
You want to go back?
The NIHS is
14.
Beyond what NIHS, you always do a CT angio as part of the protocol.
Severe
20.
Beyond NIHS 7 and above, you always do CT angio as part of the CT scan. Whether it's MR with MR angio or CT with CT angio, you always do an angiographic study as part of the initial patient, because these patients are very likely to have large vessel occlusion.
So what is that score? NIHS, that is the question. You have to answer. Okay. Right. Thank you. Team B. A 57-year-old man presents to the emergency department at 7 a.m. after waking up at 6:30 a.m. with right-sided weakness and expressive language difficulties. He was last known well when he went to sleep at midnight. His NIHS score is 10. The head CT shows no acute hemorrhage. Assuming he meets other inclusion-exclusion criteria for intravenous thrombolysis, which of the following additional imaging findings is required to administer IV TPA to this patient? One is favorable ratio of penumbral tissue volume compared to core volume, lack of early ischemic changes, no additional imaging findings are required, occlusion of a large intracranial vessel. Thrombolytics should not be administered regardless of additional imaging findings. So your time starts. Right. Think.
We'll go with option E.
Audience, please. D. Occlusion of large vessel. That doesn't mean that whether you can is A. That's correct. We have to know the ratio. A favorable ratio of anular tissue volume compared to the core volume. He is outside the traditional window for IV thrombolysis since he was last known well 7 hours earlier. But he may still be a thrombolytic candidate based on tissue window. If imaging demonstrates that infarct core is small relative to the region of the hypoperfused tissue, still at risk. This is the basis for wake-up imaging protocols that allow patients to be treated up to 9 hours after last known well, which we discussed in the pre-quiz, that is wake-up stroke. Diffusion flare mismatch. So that's the report. Any comments from the judges?
No, perfect. That is exactly what the answer is. So after till 4.5 hours, you don't need to show what sir said, the mismatch. After that, you need to find, till then time is brain and then mismatch is brain, because you need to show on imaging that there is some live ischemic salvageable viable tissue remaining, and for that we need this core to belong. Go ahead.
Question to Team C. A 49-year-old woman presents with acute onset of hemiplegia progressing to quadriplegia over the next 2 hours. On examination, she seems awake. However, she is unable to verbalize and has increased oral secretions. She can't move her eyes horizontally, but is able to move them vertically and blink. Which of the following is most likely to cause this? Bilateral thalamic infarcts, lateral medullary infarct, top of basilar occlusion, infarct affecting the base of pons bilaterally, infarct affecting the dorsal midbrain.
Infarct affecting the base of the pons bilaterally, it's pontine hemorrhage.
Patient is in a locked-in syndrome caused by basilar occlusion leading to bilateral infarcts at the base of the pons, affecting long tracts but preserving the reticular activating system. Patient is awake, consciousness is preserved, they can blink, move their eyes vertically, however they are quadriplegic, unable to speak, and have impaired horizontal eye movement. Question to
Yeah, like I said, an earlier question also had the same message to learn. If the horizontal gate center is in the pons, the PPRF, and the vertical gate center is in the midbrain, RIMLF. So here the horizontal is gone and the vertical is intact. Either way, if there is a bilateral lesion, patients should be quadriplegic. But then the clue lies in the way the gaze is affected and that the patient is alert. This is the classic scenario patient present. This is called operative.
Question to Team B. This is about venous sinus thrombosis. What of the following is correct regarding thrombosis of the venous sinuses? Diplopia with 6 cranial nerve palsy is specific for cavernous sinus thrombosis. Headache is present in less than 50% of cases. Increased intracranial pressure is uncommon. Superior sagittal sinus thrombosis will produce bilateral thalamic venous infarcts. Seizures are more common in venous infarcts as compared to arterial infarcts.
5 seizures are more common in venous infarcts as compared to arterial.
Super.
You are correct. Seizures occur in about 40% of patients with venous infarcts, much higher than those with arterial.
This is to group E. Again, stroke localization. A 51-year-old man presents with ataxia. MRI was obtained and is shown here. Which of the following will most likely result from this injury? Is it vertigo, nystagmus, right-sided ptosis and meiosis? Is it vertical gaze impairment, right, third and sixth nerve palsies? Any sensory loss to pain and temperature on the left side of the face? Any sensory loss to pain and temperature on the right side of the body?
A. Vertigo, nystagmus right-sided, ptosis and meiosis.
That's correct. These are big hand. The MRI demonstrates restricted diffusion in the right left of medulla and cerebellum, which manifests with Wallenberg syndrome. Left of medullary infarct is caused by occlusion of the pica, the posterior inferior cerebellar artery, and is often associated with occlusion of the vertebral artery also. Acute stroke intervention. The question goes to F.
Yes.
Sir.
A patient suddenly developed aphasia and right hemiparesis 50 minutes earlier during a healthcare maintenance examination. There is no contraindication to IV thrombolysis. Which of the following approaches to the administration of IV TPA is most appropriate? Administer IV thrombolytic therapy at a reduced dose if imaging shows large vessel occlusion, and endovascular treatment can be initiated within 3 hours of symptom onset. Administer IV TPA at full dose regardless of feasibility and timing of EVT. Base decisions regarding IV TPA on the patient's platelet count. Delay treatment with IV thrombotic therapy until a vascular imaging study has been completed. Withhold IV thrombotic therapy if imaging shows large vessel occlusion and EVT can be initiated within 3 hours of symptom onset.
So B.
Administer. Give them a big hand. Administer IV thrombolytic therapy at full dose regardless of feasibility and timing of EVT. Although some studies have suggested that the effectiveness of EVT for acute stroke is not enhanced by administering IV TPA in patients who are eligible for it, other studies have suggested the opposite. A recent meta-analysis failed to demonstrate non-inferiority for purely EVT. The current best practice is still to administer IV TPA to all patients with acute ischemic stroke who are also eligible for EVT regardless of whether it is planned or not. Comments from the judges?
As Sir has rightly mentioned, endovascular therapy has to be considered in all. However, remember in a large country as ours, there are very few institutes where we have in-house endovascular therapy. Almost no taluka has. So everybody should be still given the opportunity of IV license. Followed by endovascular if the patient doesn't improve.
A 34-year-old man presents with vertigo, neck pain after riding a very wild roller coaster ride. Examination demonstrates anisocoria with mild ptosis on the left side, nystagmus, reduced sensation on the left side of face, and left-sided ataxia. Which of the following is the best diagnostic test to evaluate the cause of the condition? A carotid ultrasound, transcranial Doppler ultrasound, transthoracic echo using bubble study, catheter angiogram of the craniocervical arteries, or time of flight MRI of the circle of Willis.
D. Catheter angiogram for the cervicocerebellar arteries.
Super.
Comments?
Why not MR angio since it's a non-invasive modality? Why not the last option?
Since it is being done for the circle of Willis because it is a motor vascular accident, so we thought that the cervical column will also be involved. So we should go for the cervical artery also.
Yeah, so your etiology you're thinking of here is?
It is a neck fracture.
Fracture?
Neck से भी
Dissection. Vertebral dissection because of whiplash injury.
Patient is likely to have a left vertebral artery dissection causing lateral medullary syndrome. Most common site is at the level of C1, C2 where the artery is mobile as it leaves the transverse foramen to enter the cranium. Gold standard test for diagnosis of arterial dissection is catheter angiogram to evaluate craniocervical arteries, which will demonstrate narrowing of the artery, extension of the dissection, and intramal flap or a presence of any double lumen. At the end of the second round, we will have the scores.
One later? Okay. All right. So now the question goes to team A. Now this time my colleague says we'll start from G and come back. Yes. Okay. Thanks, Dr. Dulari. So this is about secondary stroke intervention. A 71-year-old woman with hypertension admitted with stroke. Cardiac telemetry reveals atrial fibrillation. Transesophageal echocardiography shows left atrial enlargement and severe mitral stenosis. Chronic treatment with which of the following antithrombotic agents is indicated for secondary stroke prevention in this patient? Mitral stenosis, atrial fibrillation, and you have to prevent the stroke.
B. Aspirin.
I am afraid. Yes, for audience. Warfarin is correct. Warfarin. While direct oral anticoagulants have been demonstrated to be at least as efficacious and safer, that is lower risk of ICH, than warfarin in patients with non-valvular atrial fibrillation. But patients with valvular atrial fibrillation, that is with moderate to severe mitral valve stenosis or mechanical valve replacement, they were excluded from the trials of these agents. In addition, dabigatran was demonstrated to increase both thromboembolism and bleeding complications compared to warfarin in patients with mechanical heart valves. Thus, warfarin is the antithrombotic treatment of choice in patients with valvular atrial fibrillation.
So team G, which do to monitor a patient?
On warfarin.
INR.
Very good. So this is for group F about IVTPA. A 69-year-old woman presents to the emergency department at 2 hours and 35 minutes from the onset of left hemiparesis and hemi-neglect. Her NIHS score is 12. A brain CT shows no hemorrhage. Which of the following statements is correct regarding IVTPA? The risk of hemorrhage with TPA is similar to placebo. Earlier administration carries a better prognosis and a lower risk of hemorrhage. There is no maximum dose. The use of TPA improves short-term but not long-term clinical outcomes. TPA should not be administered beyond 2 hours from the onset of symptoms. So you will have to choose the correct answer in this. Yes, team F.
So option D.
You want to say D?
Yes, sir.
The use of TPA improves short term but not long term. Yes?
So B.
Is it changed or is it B right from beginning? Be true to yourself.
Sir.
D, huh? Okay, D is wrong. You make up your mind. Therefore, I mean, judges say you can pick.
We'll lock D.
Yes, you lock D, huh? Is it lock D?
Since they said D first, I think we should lock D.
What do our judges say? What do you say, sir?
What are the rules? You
Okay
said,
then.
You said
Alright.
best possible answer, no, I think.
First of all, I think you decide the answer first because you have the timer there. This time we will, forgive her. But just you can answer just around 5 seconds before the timer gets over. And take only one final answer. Otherwise, what happens?
Confusion.
I think your rule said that best possible answer.
Something
like that.
Yeah.
So if they give the right answer within 45 seconds, I think we should consider it as correct.
That's what judges feel. Okay? Alright, so we lock at B. Is it? Or D? Still you have a choice.
B.
Yeah. I don't know. I don't know the correct answer. You select B. Or judges say, can I go ahead, sir?
Yeah, go ahead.
It is B. The TPI is a thrombolytic agent that is used intravenously for treatment of acute ischemic stroke. Earlier administration correlates with better prognosis and lower risk of hemorrhage when compared with the late administration of the medication. Okay?
Just because the window is 4.5 hours, don't wait until 4 hours 20 minutes. And second, there is no point giving such an expensive drug with high hemorrhage risk if the long-term outcomes were not good. The long-term outcome, because modified ranking is much better for those who receive it.
Since there is some unrest in the groups, this facility is extended to other groups also. Within 45 seconds, you can change your answer.
But only for this round.
Only for this round. Okay? All right? All others are satisfied? Okay.
Question.
But then they will pick up 3, I think, and any of them can be.
Last answer is the best answer.
Last answer will be the best.
Yeah, they have to lock and tell. We lock this.
Question to team E on biomarkers. Which of the following is a biomarker of atrial dysfunction that may be associated with increased chance of acute ischemic stroke and increased rate of atrial fibrillation detected after cryptogenic stroke? Mitral valve prolapse on echo, plasma and terminal pro-BNP, premature ventricular contractions on Holter, serum trop-T or U waves on ECG.
Option? Give them a big hand.
Presence of atrial dysfunction in patients with cryptogenic stroke may be identified as an increased chance of recurrent stroke. Several biomarkers of atrial dysfunction are identified like increased LA enlargement, frequent premature atrial contractions, atrial fibrosis and N-terminal pro-BNP. Question to team D on TIA. A 72-year-old lady with history of diabetes presents with transient visual disturbance on the right side. On further questioning, she reports she has experienced a transient diminution of vision on the right eye, progressing from the upper visual field to the lower visual field like a shade falling. This lasted 10 minutes and resolved on its own. Which of the following is correct? Patient is having transient ischemia of the left occipital cortex. Transcranial Doppler will demonstrate increased velocity in the basilar artery. Right ICA is stenotic with an atherosclerotic plaque. Left ICA is stenotic with atherosclerotic plaque. Fundoscopic examination will demonstrate papilledema.
Option C, the right ICA is stenotic with an atherosclerotic.
What is this phenomena called? Very good, very good.
Very good, excellent. Give them a big hand.
Patient has transient monocular blindness or amaurosis fugax caused by atherosclerotic stenosis of the ipsilateral ICA, in this case the right side. Retinal artery originates from the ophthalmic artery, which is a branch of the ICA. Transient occlusion of the retinal or ophthalmic arteries may cause amaurosis fugax.
Okay. In a patient with ischemic stroke who is found to have a patent foramen ovale, which of the following findings on diagnostic studies increases the likelihood that PFO is pathogenic rather than incidental. Atrial septal aneurysm, internal carotid artery dissection, left ventricular hypertrophy, small right to left shunt, subcortical infarct location. Group C,
Fifteen more seconds.
Subcortical infarct location.
subcortical infarct location is the wrong answer. Audience. You want after the audience?
I'm willing the audience.
Audience. Anybody?
Yes, audience, come on.
Yes.
Small right to left.
What one?
Small right to left.
Small right. Wrong answer. Someone in the back. Very good. Excellent answer.
There.
So, atrial septal aneurysm, patent foramen ovale is found in approximately 1/4 of the general population. It is important to determine the likelihood that a PFO is pathogenic when considering treatment in the patient with stroke. It is more likely to be pathogenic in those with a large shunt, associated atrial septal aneurysm or both, as well as in young patients without conventional vascular risk factors who have cryptogenic cortical strokes. So this is the answer. Any comments, sir? Shall I go ahead? Now the question is to B. This is about infarct related artery. Now just concentrate on this. A 40-year-old man presents with tinnitus, unilateral hearing loss, nausea, vomiting and vertigo. On examination, he has nystagmus, ipsilateral attack, ipsilateral syndrome, and contralateral sensory deficits to pain and temperature of the arm, trunk and leg. Which of the following is the most likely diagnosis? Is it ICA stroke, pica stroke, midbrain infarct, occipital lobe infarct, superior cerebellar infarct?
Option A, ICA stroke.
I think give them a big hand. This patient has an infarct in the distribution of the ICA. The clinical presentation of ICA infarct is variable, but may be similar to that of pica or Wallenberg syndrome. However, the difference is the ipsilateral deafness that occurs with ICA infarcts. With ICA infarcts, hearing loss has been attributed to involvement of the lateral pontomedullary tegmentum.
Team A, stroke with raised intracranial pressure. A 21-year-old female presents to the clinic for evaluation of headache. She's 14 weeks pregnant. She presents with 1 week of holocranial headache. Headache is worse at night, causing blurring of vision, and she has bilateral papilledema. This is a picture of her MRI. What is the most likely diagnosis? Pseudotumor cerebri, meningioma, venous sinus thrombosis, preeclampsia, or optic neuritis?
Times.
answer, you don't have to wait.
Venous sinus thrombosis.
That's the correct answer. Pregnancy is a hypercoagulable state and dehydration could increase that. Can you go back and tell us what is the abnormality seen on the imaging? Where?
Cause. Nystagmus worse with visual fixation, decreased hearing in one ear pain, tinnitus in 1 year, acute onset. What is the correct answer?
D. Acute onset.
I'm afraid. Audience. A is the correct answer. It is very important to differentiate peripheral from central vertigo. The nystagmus that improves with fixation is a peripheral vertigo. So that's the A is the correct answer. May I request Madam Sangle to join me in conducting the quiz? Please come, Madam. Say, interact with students a bit. Come, please. Okay. This is for team F. Secondary stroke prevention with anticoagulation. That will be the question. Short-term anticoagulation is indicated for patients with ischemic stroke. Which of the following associated conditions you will do that? Is it aortic arch atheroma greater than 4 millimeters in size, atrial myxoma, infective endocarditis, left ventricular dysfunction with thrombus, non-ST segment myocardial infarction? Yes.
Sir, B. Atrial myxoma.
I am afraid. Audience. D. Who said D? Okay. Chocolate there. Left ventricular dysfunction with thrombus. Left ventricular thrombus is associated with an increased risk of stroke, systemic embolism, and death. Evidence suggests that anticoagulation can reduce the risk of these events. Current guidelines recommend vitamin K antagonist therapy for at least 3 months. Limited support exists for use of direct oral anticoagulants. So the answer is correct. May I ask Dr. Nitin Gadkari to join me in conducting the quiz?
So the next question is about stroke etiology. Which of the following underlying conditions should be considered in an adult patient without atherosclerotic risk factors who has ischemic stroke in the setting of an acute ascending aortic dissection? Whether it is heroin abuse, is it Kawasaki disease, is it Marfan syndrome, is it a patent foramen ovale, or is it a thrombotic thrombocytopenic purpura?
Excellent answer.
That's the correct answer.
The Marfan syndrome, aside from hypertension and atherosclerosis, several genetic, connective tissue and inflammatory disorders can increase the risk of ascending aortic dissection. These include such conditions as Marfan syndrome, Ehlers-Danlos syndrome, and Turner syndrome, giant cell arthritis, and syphilis, etc. So you have to think of etiologies in stroke in young.
So now the question is to question team D. It is regarding the infarct related artery. We have to pick out the right answer. 59-year-old woman presents with altered mental status. There is a restricted diffusion on the MRI which is shown over there. Which of the following is most likely diagnosis? Whether it is a bilateral anterior choroidal artery stroke, or it is a stroke from occlusion of the recurrent artery of Hübner, it is a stroke from occlusion of the artery of Percheron, stroke from occlusion of the pericallosal artery, or is it a superior sagittal sinus thrombosis? You can look at the image which is given in the MRI which can help you to decide your answer.
Option C, stroke from occlusion of the artery of Percheron.
Excellent answer. Give them a big hand, please. Shows bilateral thalamic infarction, which can be seen with occlusion of the artery of Percheron. The P1 segment of the PCA gives rise to interpeduncular branches that will provide vascularization to the medial thalamus. Most frequently, these branches arise from each posterior cerebral artery separately and will give perfusion to thalamus on their respective sides. But in some cases, a single artery called artery of Percheron will arise from the P1 segment on one side, will supply the medial thalami bilaterally. This is a normal variant. If an occlusion of the artery of Percheron occurs, the result will be an infarct in the medial thalamic structures bilaterally as shown in MRI. So this is a very good answer, and similar things can happen in deep venous sinus thrombosis also whenever there is. So for the last 3 questions, I request sir, may I ask Dr. Alurkar to come? Last 3 questions you conduct, please. He's going to. Which is the group of that you have to go now to C. C. Yes. Just one.
This one? Okay. So the question is on secondary stroke prevention. A 70-year-old woman presents to the emergency department because 2 hours earlier she suddenly developed a right facial droop, weakness of her right arm, and difficulty producing words. The symptoms completely resolved within 45 minutes. She has a history of hypertension and hyperlipidemia, but not on any medications. Her BP is 150/90. Her neurological examination is normal, and MRI shows scattered areas of increased T2 signal consistent with chronic ischemia, but no evidence of acute infarct. Carotid ultrasound shows 40 to 60% stenosis of left ICA. In addition to initiating treatment for hypertension and hyperlipidemia, which medication regimen would be most appropriate? First is aspirin alone. Second is aspirin plus clopidogrel. C is aspirin plus warfarin. D is clopidogrel alone. E is warfarin alone. Team C.
Option C, aspirin plus warfarin.
Wrong answer. Anybody else from the teams? Aspirin and clopidogrel is the right answer. Audience?
Agree?
Okay. क्या हो गया?
Got to come down to this here. और नीचे आओ. 26. 26 means you have two slides. 52.
The anticoagulate when we have a cardioembolic source of
This one?
infarction.
That is cardioembolic, no? TIM.
Aspirin plus clopidogrel by virtue of two main trials has been proven to be
This
the
I
best
told, no?
combination unless there is a contraindication to do so. So we all should know about aspirin clopidogrel both in acute ischemic stroke and obviously in MI, ACS. In both we have the same combination. It is the most popular.
Yeah, next. Yes. This is one. Just press one. This press.
And just for if somebody wants to, then there has been a trial ticagrelor as well, which is another antiplatelet, which was already used for ACS. Now it is proved to be effective even in acute ischemic stroke. In those which NIHS less than say 6. The foundation secondary prevention is obviously the antiplatelet, anticoagulation and statins, and we all actually, even those who are going to stay as physicians will carry a large burden of responsibility of prescribing these medicines to acute ischemic stroke, and they should have the knowledge of this. It is impossible for every stroke to follow up later on with a neurologist in our country.
Next answer. Next.
Is it okay?
नहीं ठीक है? Okay, done. Okay. Next question is to Team B. A 49-year-old woman with anxiety, depression, hypertension and diabetes presents to the emergency department with a sensory deficit affecting her right face, arm, trunk and leg, which started yesterday in the evening. The symptoms reached their peak on the morning of presentation. There are no motor deficits on examination. Which of the following is correct? No further workup is needed and the patient can be discharged from the emergency department. Given the lack of motor deficits, her symptoms are most likely related to anxiety. The most likely location of the lesion is in the cortex. Cardioembolism is the most likely etiology. Small vessel disease is the most likely etiology. Hello. Hello. 25 seconds left. There is no negative marking.
Go ahead. Option E, small vessel disease.
Yes.
Okay. Option E is the right answer. The patient presents with pure sensory symptoms which can be seen in a pure sensory lacunar infarct. A lacunar stroke occurs from occlusion of a small penetrating artery as a consequence of chronic hypertension. Diabetes and hyperlipidemia also play a role, but to a lesser degree. These small vessels develop lipohyalinosis with vessel wall degeneration and luminal occlusion. Next question is to team A. A 52-year-old gentleman with history of smoking, diabetes and hypertension presents with acute onset of left hemiparesis affecting the face, arm and leg. He recognizes the left side of his body and acknowledges the deficits. His gaze is not deviated, which is the most likely location of the vascular occlusion. Trunk of the right MCA before bifurcation, lenticulostriate branches of right MCA, superior division of right MCA, in right PCA, inferior division of right MCA. Sentence number 2 is the critical sentence here. Also 3. That was a big clue, huh? 20 seconds left. Ten seconds left. There is no negative marking.
Right PC.
Right PC is the audience. Right PC is the right answer or the wrong answer? Yeah, wrong answer. So what is the right answer, audience?
Lenticulostriate branches.
Lenticulostriate, yeah. So here the patient recognizing the left side of the body and absence of gaze deviation indicates that the cortex is not involved, right? So it has to be a subcortical location. So it's a pure motor lacunar stroke syndrome. Infarct is most likely in the posterior limb of internal capsule since there is a hemiplegia from occlusion of one of the lenticulostriate branches of MCA.
So this finishes the stroke round, and I want to announce the scores. Yes.
So that was quite a comprehensive stroke round, and I am sure that we all have learned so much from that. Now announcing the result of this round 1. Team A, that is Maimar Medical College, is at 30 points. Team B, Bharati Medical College, is at 20 points. Team C, AFMC, is at 10 points. Team D, SKNMC, is at 40 points. They have answered all the answers correctly, and the same is Team E, BJMC, with all the correct answers, that is 40 points. Team F, AFMC, has got 20 points. And Symbiosis Team G has got 10 points. But as I said, this is only round 1. There are still more rounds to follow, and there are many upheavals which can be there. So I ask all participants to stay alert and don't lose hope, because the next questions and the next rounds can really turn the fortunes upside down. Thank you.
So may I ask Dr. Shripad to come and help me out in conducting the next round? That is a clue round. इधर नहीं दिख रहा है. No, no. Yeah, now it's not seen. ऐसे है ना? I'll do one and then
You do.
it's not getting projected.
Okay.
Okay. That's a clue round. The rules are like this. 3 questions per team. A clinical case scenario will be given and answer will be expected without clue 30 marks, 1 clue 20 marks, 2 clues 10 marks. No negative marking. Possible by buzzer to other contestants for 10 points. 30 seconds first clue and after 30 seconds then second clue. Okay. Is it okay? Right. Shall we start?
All working.
If at the end of the 2 clues the team is not able to give the correct answer,
Correct.
and then when we say, okay, the question now passes to the other contestants, then you can press the button. Before that, please don't press.
Each team gets 2 clues to answer.
At the end of the 2 clues also, if the team is not able to answer, then only it is going to be passable. And we will say, now it is, we are going to pass the question and then you can press the button. Before
Okay.
that, please don't press.
So understood? Each team gets 2 clues.
If the answer is wrong, then the question is discarded, right? If the answer is wrong, even after 2 clues.
No.
No, it passes on to the other contestants.
So, but that team has given the wrong answer, so we can also attempt on the same thing.
The team which has given the wrong answer cannot attempt the buzzer, right? Because it is passing to the other contestants. So the team, like suppose if I ask a question to team A and they have given it wrong, all the other teams are eligible to press the buzzer when we say that other contestants can now attempt this question.
Right.
At that time, nobody presses the buzzer.
If they want clues, they will ask, give me a clue. Then again, give me a clue. Then say no. If they answer wrong, as Dr. Nitin said, you wait for the order to be, budget to be given, okay? Right, let us do one. A 45-year-old patient with history of hypertension, ETMA, end-stage renal disease on hemodialysis, presents with altered mental status and a blood pressure of 210/118. While in the emergency room, he has a generalized tonic-clonic seizure and requires endotracheal intubation. He is then admitted to neurocritical care unit. His brain MRI is shown. Which of the following is the most likely diagnosis? Is it embolic stroke, acute disseminated encephalomyelitis, intracerebral hemorrhage, viral encephalitis, posterior reversible encephalopathy syndrome?
One more thing which I want to clear over here, if you are not sure, you don't answer, because if you answer wrong, the question will directly be passed. So you cannot answer one, then you can ask for you answer wrong, then ask for a clue.
Very
If you
important.
are not sure, you ask for a clue.
Yeah.
If you answer, suppose you say that answer is X, Y, Z, and then that answer is not correct, the question is going to pass.
Perfect.
Switch off.
2 seconds.
We would like a clue.
Clue. Due to disruption of blood-brain barrier, this thing happens.
Timer starts now.
No, we can't.
We can do that.
But that will again eat into time, no? Say next time onwards, it's not allowed. You register yourself. After clue is asked, no going back.
पेपर है ना, पेपर पे लिख दो.
You want second clue?
टाइमर नहीं वेट टाइमर अच्छे से चल रहा है सर.
Only 8 seconds left. If you want a second clue, you can go for it.
Second clue or no? Ah.
Do it.
E. It's excellent.
Yes. Right answer.
The findings in MRI will resolve repeat imaging after 2 to 3 months. So the patient has posterior reversible encephalopathy syndrome. The press is usually based on neuroimaging demonstrating a characteristic pattern of vasogenic edema predominantly in the posterior cerebral region, especially occipital and parietal lobes. Risk factors and causative factors include renal failure, hypertension, organ transplantation, autoimmune disease, immunosuppressive drugs, septic shock, preeclampsia, eclampsia. Next, B.
Team A gets 20 marks, correct, sir? Yes. Yeah. So now, Team B, corticosteroids are used for the treatment of intracranial hypertension associated with which of the following etiologies? Traumatic brain injury, intracerebral hemorrhage, ischemic stroke, acute obstructive hydrocephalus, and brain tumors. Team B. You have around 10 seconds. One clue. So shall I just press? Gurti sir? Yeah. Not used in the presence of cytotoxic edema.
It's okay. What does it matter? How does it make it? You have to answer.
15 seconds. No. Okay, the answer they have given is acute obstructive hydrocephalus. Pass. Who was the first? G.
A brain tumor.
Good. Now just one thing, how many marks do the buzzer people get? 10 marks. So 10 to G. Okay. So that was the second clue anyway. So used for treatment of intracranial hypertension associated with brain tumors and metastasis. They are beneficial in vasogenic cerebral edema seen with tumors. However, exact mechanism of action is not well understood. They are not useful in the management of other conditions commonly associated with edema such as trauma. Never to be used in stroke, because actually the outcomes are worse if you use steroids in either ischemic or hemorrhagic stroke. Okay, so the next question goes to team C now. A patient admitted after suffering head trauma. His head CT is shown in the figure. Regarding this condition, which of the following is correct? Hemorrhage originates from tearing of cerebral surface bridging veins, from rupture of middle meningeal artery associated with Charcot-Bouchard aneurysms. Lipohyalinosis is present in cerebral vessels. Coiling or clipping of the culprit aneurysm will prevent rebleeding. Time starts now. Please note the key words of the options so that we don't have to go behind. – 10 seconds.
You can take a clue if you want. So take it within 5 seconds now.
Clue. Even trivial trauma also causes rupture of these vessels. Okay. So whatever, middle meningeal artery. That's the wrong answer. Is it C? Yeah, I just said that's the wrong answer. Okay. नहीं ठीक है, किसने किया? Yeah, I think what I will have to do is the moment, because what is happening the moment I say the wrong answer, you guys are pressing the buzzer. So I'm going to beg your pardon?
Count of 3 to 1.
3, 2, 1 and buzzer.
Yes,
I think doesn't make sense. No. What I will do is, I think I'll do is press. I'll say press. So that's the only thing. Now this time, who? Let us give it. D. D.
That was an example, right?
नहीं, इस बार तो आप लोगों ने सबने प्रेस किया ना कि नहीं किया? हाँ? Okay. I'll say 3, 2, 1 now. This 3, 2, 1, press.
Sir. Now sir set the rules now.
ये बजर थोड़ा डी, हाँ डी ना दूँगा. तो ठीक है. D.
Cortical veins.
Okay. Actually, B has also said the answer. So
Differentiate between subdural hematoma and extradural hematoma.
okay. ठीक है. So about the buzzer, I'm not going to say whether right or wrong. I'm just going to say press. That's the only way I have to go. Otherwise, you're 3, 2, 1 से भी मतलब नहीं ना, वो 1 को ही प्रेस करते ना, फिर वो मुझे नहीं समझता कब करे.
Very clear that once the word press has been announced, then only you have to press.
Yeah.
And of course, wrong and right or whatever he mentions before that, it doesn't matter. First of all, we will avoid to mention whether
Yeah.
it is right or wrong.
Yeah.
We will just say press, and you have to be very careful for that word, and immediately you have to press. Okay?
Absolutely. I know. See. To the team D. Let's go to the next. Now it's again team D, correct? Yeah. So as we discussed, crescentic and concavo-convex with the difference between the subdural and the extradural. Question 4 starts now. 34-year-old woman, 2-week history of tingling in the legs and more recently weakness and numbness up to the waist for the past 3 days. She states that she had diarrhea for 2 days, about a week before the symptoms began. She attributed it to food poisoning, mild paraparesis associated with sensory loss and diffuse areflexia, CSF protein level of 213 mg per deciliter without pleocytosis. MRI shows enhancement of cauda equina consistent with acute inflammatory demyelinating polydipropathy. Which of the following factors is associated with a poor prognosis for symptom recovery? Patient age less than 40 years, progression of symptom over 14 days, areflexia in arms despite lack of weakness, protein more than 200 milligrams per deciliter in CSF, previous diarrheal illness. D.
Clue.
It is related to molecular mimicry due to sharing of antigens.
We can't go back to the question.
We can actually. एक मिनट है. नहीं जा रहे. ये देखो. 14 days, areflexia, protein and diarrhea.
Working memory.
10 seconds.
Proteins more than 200.
Press. किसने किया? B.
Progression of symptoms 14 days.
Press. एक बार ये. Okay. Audience. चलो सेकंड क्लू भी दिखाते. Axonal variant. Anybody has answered? क्या? Daryl, अच्छा आंसर किया. Okay. Typically recover occurs within 4 weeks of symptom onset, although complete recovery may require several months. 15% continue to explain severe disability. Other factors are rapid worsening, age more than 60, mechanical ventilation, CMU or a diarrheal illness, which is Campylobacter. Okay? So now team E. Question starts now. Which of the following MRI findings is most likely to be present in patients with spinal neurocysticercosis? Diffuse leptomeningeal enhancement with GAD, diffuse dural enhancement with GAD, intracranial cysts, tethered spinal cord, and syringomyelia. Time starts now. Clue? Okay. May be associated with seizures.
There are two clues which are available. One clue is already there. If you want, you can take one more clue.
Just a minute. Maybe associated.
They are giving option A, diffuse leptomeningeal enhancement with GAD.
कौन है? B.
Tethered spinal cord.
अभी गया ना. Audience. It's caused by infection of the eggs of tinea. Okay. The brain is the most common. 1% have spinal, and they also have intracranial cyst.
Isolated spinal neurocysticercosis
Is not common.
always associated with the intracranial.
Okay.
So here you see the reference. It's given. You can refer.
Yeah.
See, if the buzzer is designed in such a way that whichever team presses it first, other buzzers are going to become disabled.
Okay.
And that is how the spot, it becomes easy for the job of a spotter to see who has pressed the buzzer. So if you want, you can all press it once and see whether your buzzer is working or not. Now it press. Okay, wait, let it be green. Wait, press it. Wait, let it be green. Press. Wait, press. 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 Wait. Okay.
Yeah, they are all
Once
working.
is working. Huh?
Yeah.
Chalo.
Just 1 second. You can refer that. Remember this. That's why I know your intelligent people will be there. That's why I put a reference every time. Right?
F. Shall we start? A 75-year-old woman presents with a 12-month history of gradually increasing spasms, sensory loss in both legs, reports taking numerous vitamins and other nutritional supplements. Examination reveals spastic paraparesis and vibration, sensory loss in both legs, and results of laboratory studies reveal vitamin B12 deficiency. Management should consist of adding vitamin B12 to the patient's regimen and discontinuing which of the following supplements: calcium, copper, folic acid, zinc, and thiamine. Time starts now. F. 15. It has a role in cell division and wound healing. No prompting. It has a role in cell division and wound healing. Yes? What do you want? Okay. I think that's the right answer. Correct. So, trace element again. Yeah, it's a common cause of myelopathy, important to identify in lab studies because the neurological manifestations are easily reversible. Excessive zinc can precipitate copper deficiency, impairing the functioning of vitamin B12. If patient has copper deficiency, adding a supplement would also be appropriate. So, those who have the classic finding and normal B12, you should suspect copper deficiency myelopathy, and excessive zinc can cause copper deficiency. Next, team G is ready? Okay. In patients with mild cognitive impairment, all of the following may predict a higher risk of progression to Alzheimer's disease except medial temporal atrophy on MRI, hypometabolism on FDG PET scans, apolipoprotein E4 genotype, low CSF levels of total tau and phosphorylated tau, and increased activity of on amyloid PET scans. Just read carefully. Maybe I'll give you 5 seconds extra. It's a lot of terminologies. And it's except.
So B, hypometabolism on FDG PET scan.
Press. किसने बोला? F बोलो.
Option B, low CSF levels of total tau and phosphorylated.
That's the correct answer. Yes. So the clue.
Brother, you should please wait so that we can confirm that it is you who has to answer. Okay? This time it's okay.
So the clue was biomarker, as she rightly, and cellular inclusions in Alzheimer. So we know we are trying to find what mild cognitive decline will progress to frank dementia, and predictors include imagings such as MRI, FDG PET, and higher activity on amyloid and tau PET scans. And carriers of apolipoprotein 4 are also more likely progress, and it is the low levels of amyloid beta 2 and high levels of tau. Tau has been implicated in the pathogenesis and prognosis of Alzheimer's. So high levels of tau. Oh, sorry. So shall we skip this, sir? Okay, we'll skip it. Do we have extra questions? Okay, let's give this to audience then. Which of the following medications is absolutely contraindicated in patients with Lewy body dementia? Citalopram, alloperidol, memantine, carbidopa, levodopa, and rivastigmine. Remember the options. And I have given one clue. Yes, that's the correct answer. That indeed is the correct answer. It is called neuroleptic sensitivity. Okay, and you also used in this thing. So now where do we start? Aap karo. We'll let Dr.
We'll start with team A.
Team A again, okay?
Exquisite sensitivity to neuroleptic medication is a hallmark of diffuse Lewy body disease, and life-threatening complications can be reported. So now we'll start the second round of the clues with team A. A 50-year-old male attorney presents with 4-month history of increasingly inappropriate behavior, including leaving the house in pajamas, failing to groom himself normally, inability to balance his checkbook or pay bills, and most recently inability to cook or clean the house. Due to inappropriate behavior at work, he was placed on leave of absence. He has reported joint pains, fever, chills, nausea, diarrhea. Examination reveals that he has poor appetite and memory, a right upper quadrant field cut, slurred speech, right hemiparesis, and significant ataxia. Which is the most likely diagnosis? CJD, can you start the timer? Wernicke's encephalopathy, herpes simplex encephalitis, vascular dementia, or Whipple's disease. You'd like a clue? It is not a metabolic or toxic related. I hope you've noted down the options.
HSV encephalitis.
No. Press.
Vascular dementia.
Audience?
Yes. Madam,
See, the rules are very clear. Unless and until you are asked, don't press the button. And after pressing, also you have to wait to give the answer. Don't give the answer. This time you were lucky that they did not listen.
It's not a viral disease. Yes, next.
Question to Queen. Yeah. Answer is E. Patient's clinical presentation consistent with rapidly progressive dementia, multiple neurogenic and systemic symptoms. It could be any of them, but the combination of arthralgia, fever, GI symptoms, and cognitive decline most likely to be Whipple's disease. Question to Team B. 42-year-old woman presents with 3 to 4 months history of cognitive decline. Symptoms began insidiously but were rapidly increasing since onset, promoting concerns about subacute dementia. Patient has no history of systemic illness, including immunosuppression. In addition, basic lab tests and MRI brain. Which of the following studies would be included in the initial diagnosis? Serum drug levels, CT chest, abdomen, pelvis and with IV contrast, brain biopsy, CSF 1433 and EEG.
CSF 1433.
Press. Team G. You're correct. The other clue is there's no specific risk factors for this. There's one non-invasive screening test. The answer is E. Focus on treatable and reversible conditions. Initial screening would be thyroid, B12 and HIV, MRI brain, EEG and CSF. Depending on specific clinical scenarios, negative test results of these would cause additional diagnostic testing. EEG is the first line screening test without any specific risk factors for any other disease. Anyone in the participants or audience, what would you expect to see in the EEG, in CJD? No, not 3 Hertz. That would be in hepatic encephalopathies or encephalopathies. Anyone in the audience, including neurology residents? In CJD, it will be classically 1 Hertz spike, 1 spike every second. Yeah.
See, this patient did not have any specific known risk factors. So that's the reason. Okay. So it is a team C. Which of the following genes is most commonly associated with FTD ALS? That is frontotemporal dementia, amyotrophic lateral sclerosis. First, VCP, C9 or F72, TAR DBP, DMPK. You want a clue? Clue? It's a hexanucleotide repeat disorder.
TAR-DB, TAR binding protein 43.
Pressed.
Team E has pressed. Yes.
CGO.
Okay, that's the correct answer. The most common genetic abnormality in amyotroph, this is the question, but that the answer is correct. Okay, right. Next question, D. Scorer, have you noted? Team D, 26-year-old woman presents with 6 months history of dramatic cognitive and behavioral changes, including inappropriate behavior in the office. The symptoms began soon after she and her partner of several years broke up, after which time she became severely withdrawn from social interaction. Initially, she was diagnosed with depression and then developed rigidity and abnormal movements in the hands, for which she took electroconvulsive therapy for catatonia. Her symptoms failed to improve despite treatment. The past month, she has experienced seizure like episodes. Examination reveals severe memory impairment, orofacial dyskinesias, as well as the rigidity described above. CSF reveals a pleocytosis with a high protein level, and CT scans of pelvis show heterogeneous mass in the ovary. Antibodies to which of the following structures are most likely to be present in the patient's CSF? AMPA receptors, NMDA receptors, ganglionic acetylcholine receptors, GAD65, voltage gated potassium channels. Clue, okay. Most commonly cause of rapidly progressive dementia in young people. Not getting anywhere?
Receptor.
That's excellent answer. Give them a big hand. So associated ovarian teratomas and autoimmune encephalopathies are an increasingly recognized cause of rapidly progressive cognitive and behavioral changes, particularly in younger patients. And the most common syndromes is encephalitis with antibodies to the NMDA receptor, specifically targeting GLU-N1 subunit. Patients typically present with a prodrome that includes prominent psychiatric symptoms followed by development of movement disorder, language problems, seizures, any number of other neurological manifestations. These antibodies are most often associated with ovarian teratomas, although no malignancy is found in most patients. Now the question goes to E, Team E. A 74-year-old woman has progressive gait problems for the past 1 to 2 years walking. She reports occasional bladder incontinence. The patient has no cognitive complaints but scores 22 of 30 on MMSE, missing points in recall, orientation, and attention. MRI of brain is shown. Results of lumbar puncture reveals normal CSF studies and opening pressure. The patient's symptoms they do not improve following the lumbar puncture despite removal of 40 ml of CSF. What is the most appropriate next step in management? Is it repeat a high volume lumbar puncture with repeat gait and cognitive assessment after 1 hour? Insert an external lumbar drain with repeat gait and cognitive assessments after 48 hours? Administer acetazolamide therapy with repeat gait and cognitive assessments after 1 week? Insert a ventriculoperitoneal shunt for permanent diversion of CSF and reassess after 1 month? Evaluate for other causes of her symptoms as normal pressure hydrocephalus has been ruled out. You have seen the picture? It has all the features.
One
They want a clue. Clue? Okay. Acetolamide may not help.
when VP shunt.
Oh.
Sorry, ventricular
You are, but you want to give the treatment.
Now, beta, you have 16 seconds. You already chose to answer. She's already given that. You answered ventriculoperitoneal shunt, right? Okay, mister.
No.
Press.
Press.
B option.
Which is that?
Low extra.
Lumbar drain.
Lumbar drain for a longer time. Is that because?
Extra lumbar. Insert an external lumbar drain.
Yes, that's the correct answer as per the reference. Okay, you have to establish the diagnosis before you insert. So you can do VP shunting, no doubt, but first of all you have to be sure that it is that. So we'll have to insert. Okay, so they got it correct. Scoring 10 points. Okay, F. A 33-year-old woman with adult onset spinal muscular dystrophy presents requesting enrollment in a clinical trial for nusinersen, a new FDA approved medication for treatment of her condition. Which of the following is the appropriate route of administration? Everybody should know the advances in this field. Very, very important.
So intrathecal.
Excellent answer. This drug is administered in 4 loading doses every 2 weeks for 3 doses and a 4th dose after 4 weeks, maintenance dose every 16 weeks. Answer is E. This is the nusinersen is an antisense oligonucleotide that alters splicing of SMN2 mRNA and increases the amount of functional SMN protein produced, thus compensating for the genetic defect in the SMN1 gene. Nusinersen is administered intrathecally, as I said earlier, the dose. Very well done. I think good question.
Question to Team G. 32-year-old lady who has acetylcholine receptor positive myasthenia gravis has been treated with at least one inpatient course of plasma exchange and or IV immunoglobulin annually for the past 3 years. Otherwise, she is treated with alternate day dosing of prednisolone 60 and 40 mg. Dose can't be decreased to daily 40 mg because of worsening symptoms. Despite addition of azathioprine to her regime, she remains symptomatic and requires scheduled doses of pyridostigmine and outpatient plasma exchange every 1 to 2 months as needed. Which of the following is the most appropriate next step in the management? Thymectomy, rituximab, cyclosporin, methotrexate, or eculizumab?
A option, thymectomy.
I think that's the correct answer.
A large multicentric international trial with thymectomy in non-thymomatous acetylcholine receptor positive myasthenia demonstrated that those who underwent surgery had a lower average myasthenia gravis functional score at 3 years and had lower average requirement for alternate day prednisolone. So even if they don't have a thymoma, they do need thymectomy.
We'll start from G, but thymectomy is the order of the day. Whatever you do in myasthenia, you aim for thymectomy. You remit the disease with steroids or plasma exchange or IVIG. But your aim is thymectomy. Okay?
This last round, we'll start with G and go backwards. A 58-year-old man presents for evaluation of left hand resting tremor and recurrent falls for the past 18 months. There is no history of vertigo or lightheadedness. Examination reveals a 4 Hz resting tremor in both hands, which are much higher in amplitude on the left, and rigidity in both arms that is worse when he performs repetitive tasks with the contralateral hand. Patient was previously diagnosed with Parkinson's disease, yet hasn't responded to dopaminergic therapy. Thus, atypical Parkinson's is considered based on his lack of treatment response. In addition to which of the following atypical features?
Any other feature you identify?
Asymmetry of tremors, patient age at onset, early history of falls, frequent falls, worsening rigidity with contralateral movement, or improvement of tremors with activity. One atypical thing is he is not responding to levodopa. What are the other atypical symptoms in this history? You have 10 seconds. Do you want a clue or?
You want, you can take a clue.
One clue.
There may be early cognitive impairment also.
Can we see the options? History of early and frequent falls.
Correct.
Excellent. Very nice.
Atypical Parkinson's often is similar in presentation to idiopathic Parkinson's. Therefore, it's important to identify the atypical or red flag signs. Early gait instability of falls, especially within the first year, rapid progression, and poor response to levodopa therapy.
So the next question to group F. Which of the following is considered the most common non-motor symptom of Parkinson's disease? Seborrheic dermatitis, impaired olfaction, fatigue, sleep disturbance, and anxiety. Clue. Head injury survivors may also have this symptom. Press. Okay. Impaired olfaction is the correct answer. So that is an important non-motor symptom. At least 90% of patients with Parkinson's disease develop at least one non-motor symptom. Impaired olfaction 46%, depression 43%, reduced libido 42%, constipation 39%, insomnia 36%, fatigue 36%. Anxiety is not there in this list. Whoever has said that. Okay, next. E. 16-year-old girl with a 3-year history of migraines presents with episodes of dizziness and abnormal movements that began 6 months ago when she was playing soccer. The episodes are characterized by nausea, dizziness, and trouble running because her legs feel clumsy. Each episode lasts several hours to days, always in the setting of exercise or overheating. Patient usually feels normal by the next morning. Family history is significant for similar symptoms in an older sibling. Which of the following diagnosis is likely the cause for her symptoms? Familial hemiplegic migraine, episodic ataxia 2, periodic paralysis, paroxysmal kinesogenic dyskinesia, psychogenic movement disorder. Group E. Clue. Dysfunction of calcium channels is seen in this disorder. In
Option A, familial hemiplegic migraine.
press.
Team A has pressed.
Yeah,
Option D.
what?
Option D.
What is that? Read that.
Paroxysmal kinesio.
Audience.
But there is no paralysis in this.
Episodic ataxia type 2. That's correct. Chocolate. Dysfunction of calcium channels. Triggers include exertion, heat. Episodic ataxia 2, where the symptoms last for weeks to months. The one is with potassium channels and the symptoms last for hours to few days. Okay, next.
This is for team D. An otherwise healthy 36-year-old woman has a 3-month history of gradually progressive tremors in her hands with palpitations, occasional anxiety, and periods of feeling hot despite having regular menstrual cycles. She is reported an unintentional 15-pound weight loss over the past 3 months. Family history: paternal grandfather has Parkinson's, mother and maternal aunts have thyroid disease, father has tremors and has a history of alcoholism but is otherwise healthy. She denies alcohol intake. Results of neurological examination show low amplitude, high frequency tremors, 8 to 12 Hz. Which of the following is the most likely cause of her tremors? Parkinson's disease, essential tremor, thyrotoxicosis, OCP usage, or a cerebellar tremor?
Option B, essential tremors.
Press. Team E.
Thyrotoxicosis.
Right. Tremors at rest, in a postural state, or during activity. Physiological tremors are characteristically low amplitude, high frequency, or 8 to 12 Hz. Tremors are more pronounced with emotional states, fatigue, exercise, alcohol, and if they are using other drugs which can cause tremors like valproate acid or SSRIs or lithium. So thyrotoxicosis is more likely because she has family history of hyperthyroidism, anxiety, palpitations, heat intolerance, and weight loss. Question to team C. Team C, right? Cerebral perfusion pressure is calculated using which of the following mathematical equations? MAP minus diastolic blood pressure, MAP plus systolic blood pressure, MAP into intracranial pressure, MAP divided by intracranial pressure, MAP minus intracranial pressure.
MAP minus ICP.
Correct. 30 points to team C. Question to team B. A 56-year-old man is admitted in neuro ICU for 2 days ago with a large acute infarct of the left MCA territory. He now exhibits increasing lethargy leading to somnolence, increased blood pressure, and a heart rate of 44 with irregular respiration and a less reactive left pupil. The patient is immediately intubated for airway protection. Which of the following is the best strategy to reduce mortality and prevent morbidity given the patient's neurological condition? Initiate an IV drip with 3% saline at 30 ml per hour. Decrease the respiratory rate to hypoventilation. Consult neurosurgery for decompressive hemicraniotomy or durotomy. Initiate IV heparin drip with a fluid bolus and target APTT of 60 to 80. Initiate IV thrombolysis for extension of stroke ischemia. Do you need a clue? Yes. This intervention is life-saving.
Decompressive hemicraniectomy.
Yes.
That's correct.
20 points to team B.
That's the only thing that helps.
The numbers need to treat is 1 in 3 with this modality very high. Okay. 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 A 58-year-old man presents with a left-sided headache and neck pain that occurred during weightlifting. He was concerned because he felt like his left eye was droopy. On examination, you confirm that he has slight ptosis of the left eye. What is the cause of this finding? Is it overactivity of parasympathetics, impairment in oculomotor nerve function, underactivity of sympathetics, underactivity of parasympathetics, overactivity of sympathetics?
Okay, we want a clue.
I think clue से पता चलेगा. Fear, over elevation of the eyelid such as fear, and depression of the eyelid may be seen in fatigue.
Could we see the options?
You can do second clue also, then see.
Option C.
Underactivity of the sympathetics, you should read. What do you want to say?
Underactivity of the sympathetic.
I think that's correct answer. Problem is in the neck. Okay. Audience. That's over, no? We have only 2 rounds left. What is a rapid fire and a buzzer sound, right? That will be completed very fast. In the meantime, audience can answer the question so that we'll finalize the results so far. A 76-year-old man referred to right eyelid ptosis, right pupillary constriction. Also mentions that when he exerts himself, he notices that the right side of the face does not seem to sweat like the left side. Using this information, which of the following would not be a probable cause for these symptoms? A tumor at CH-T2 level, lesion between hypothalamus and ciliospinal center bulge, tumor in the right lung apex, large hematoma formation, I see a dissection involving the mid-cervical region. You have to say, does not seem to sweat like the left side. Okay, you want options? Answered already? Okay. Lesion between hypothalamus and ciliospinal center bulge. That's because the fibers of sweat of the second order, they deviate and go to the, so if it is here, the anhydrosis occurs. Otherwise, anhydrosis is not seen. That's the reason. Okay. The rapid fire questions has to be shown there, at least. Yes. ये rules लिखा
So at the end of this clue round, we have the scores with us. At the end of round 2, Team A, Mimar Medical College, is having 80 points. Team B, Bharati Medical College, is having 40 points. AFMC is 40 points. Team D, SKNMC, is 70 points. Team E, BJMC, is 60 points. Team F, AFMC, is 80 points. And leading the chart now is Symbiosis with 90 points. So as I said, lot of permutations and combinations are still there. And now we are moving ahead to a round which is called as the rapid fire round. Now I would like the timers, the timekeeper over here to be very, very meticulous. As soon as you start the clock, then only we are going to start the questions. Keep the timer for 2 minutes, that is 120 seconds or 2 minutes, whatever is there over there. In that 2 minutes, you have to answer the question. There are no negative marks, but if you don't know the answer, it is my sincere advice to you that you can say pass and then he can jump on to next question. Because if you keep on thinking about the same question, there will be less number of questions available to you. So if you are able to answer the question fast, you can answer it, or you can just say pass. Once you have passed, you cannot go back. Okay, is it clear? Each team gets 2 minutes. And they can attempt at least 5, means if they take a lot of time, they may not reach even up to 5, or 5 is the upper limit which you can attempt. Is it okay? The rule is clear to everyone? Team F? Pardon me? Total 5 questions are there. No, you cannot go back. Even if the time is left, you cannot go back because you already passed. So you have to think and then you have to pass.
So roughly you take 20 seconds.
You
20 seconds per question. You have 120 minutes.
120 minutes and 5 questions are there.
Not 120 minutes, 120 seconds.
120 seconds are there and 5 questions, 24 seconds per question. Therefore I am saying that if you pass, then you cannot go back, because you may remember it later, but then the whole purpose of rapid fire is destroyed. Okay. The rules are same for all the teams. Every question gets 10 marks. 10 marks for a right answer, 0 marks for a wrong answer. There are no negative marks in this round. Okay. Wrong answer is considered as wrong and that you cannot go back to that question again. Similar for pass.
Wrong answer, there is no minus 5.
There is no minus. It is a rapid fire round where if you give the correct answer, you get 10 marks. If you say pass, you get no marks. If you give negative answer or wrong answer, you get no marks, but then you cannot go back to the question again. Is it clear? Any doubts or any ambiguity on this point from any of the team concerned? Yes, team D, it's okay with you? A, B, C, D, everyone is fine. Okay. So when we say that your time starts now and the timer starts, then the quiz master is going to read out the questions and then you are going to answer. Okay. Can we have the timer first? Let us open first. Please check your mics.
Check. Hello, check.
Check your mics. Speak and check.
Hello.
It's not working. Please not working.
Hello.
Please don't project this. Don't project this. No projection in this. No, don't remove that. No projection.
Stop that. Question 1 answer.
No, we will not. No problem. We have others. We have other questions. You don't worry. Right?
दूसरा
Okay.
1 minute.
1 second.
Hello. It's working now. You just have to put a timer over there and please remember that this screen is showing whenever you are shifting around. So don't let them see over there.
I gathered for one more round, that's why. Timing?
Check.
Okay, just wait. Reset. The time starts now. Team A. Name the receptors responsible for color vision in the retina of the eye.
Cones.
Okay. Name the catecholamine neurotransmitter important in schizophrenia, movement, and drug abuse.
Dopamine.
Correct. Name the chemicals in the brain that produce effects similar to those of morphine.
Endorphins.
Correct. What is the name of these specialized cells that support and nourish neurons? Glial cells. Correct. Name the enzyme that normally breaks down catecholamines.
Catecholomethyltransferase. Monoamine oxidase.
That's gone. Okay. All right. Good. Okay. Yes. Right.
Ready? Team B, check your mic.
Hello.
Okay. Your time starts now. Acetylcholine causes muscle to contract by opening channels to what ion?
Sorry, question.
Ion.
Sodium.
Agreed. What is released by the pineal gland and affects the physiological changes related to time cycles?
Melatonin.
Good. The amygdala and septum are part of this group of brain structures that regulate emotion.
Limbic system.
Very good. Whereas the declarative knowledge involves facts, this type of knowledge involves motor skills. What is that knowledge? What is the knowledge required for motor skills? What memory?
Implicit memory.
Okay. No-go-A is a protein that inhibits what? No-go-A is a protein that inhibits what? Yeah, you can keep thinking. No-go-A is a protein that inhibits what? No-go, N-O-G-O. Bar A. I think if you don't know, let's go on to the next. Okay then. I think that's it. So C. Give them a big hand. Team C, reset the time. Your time starts now. At high doses, alcohol decreases the function of what receptors that recognize the neurotransmitter glutamate? It decreases function of what receptors? Alcohol decreases what type of receptors?
NMDA?
No, wrong. Sonic hedgehog is important for the development of what part of the nervous system?
So can you repeat?
Sonic hedgehog is important for the development of what part of the nervous system?
Diencephalon?
Wrong. Third question. How does cocaine affect synaptic transmission?
So pass.
What is the fastest an action potential can travel in the human nervous system?
Uh, 200 meters per second.
Several hundred meters per hour. Given. What part of the hindbrain is important to precise timing? नीचे है मेरा बोर्ड. Hey, इधर steel one. Thanks. You want me to repeat the question?
What part of the hindbrain is responsible for timing?
Precise timing.
Precise.
This is an easy question, I thought.
So cerebellum.
Very good. Thank God. Okay, very good. Next is the team D.
Check.
Yeah, let me say reset, then only you start. Okay, your time starts. Name the first MAO inhibitor which was found to help depressed patients.
Iproniazid.
Excellent answer. Working memory depends to a large extent on what part of the cerebral cortex?
Neocortex.
Wrong. Prefrontal cortex. Okay. Okay. Aspirin prevents pain by preventing the production of what chemicals?
Prostaglandins.
Excellent. The surgical destruction of what two parts of the basal ganglion can reduce the symptoms of Parkinson's disease?
Subthalamic nucleus and globus pallidus internus.
Excellent. The pallidum and subthalamic nucleus. Great answer. Name the reflex that stabilizes one leg when the other leg suddenly flexes due to the withdrawal reflex. It's a physiology question. Bachpan ka. Okay. Name the reflex that stabilizes one leg when the other leg suddenly flexes due to the withdrawal reflex.
This is the last question?
Yes. You have time. 1 minute.
Crossed extensor reflex.
Excellent answer. Why then? Excellent. Okay, now it is. 1 second. Just wait. Huh? Don't start.
Check.
Okay. Your time starts. Name the two branches of the auditory nerve.
Vestibular and cochlea.
Very good, excellent. During digestion, what hormone is released from the stomach to suppress hunger? It is also found in the brain.
Sir, can you repeat that?
Okay. During digestion, what hormone is released from the stomach to suppress the hunger? This also is found in brain. The hormone secreted in stomach.
Ghrelin.
Huh?
Ghrelin.
No. Cholecystokinin. Okay. All right. Let's go to the next question. Introducing the gene for a neurotrophic factor into the nigrostriatal pathway in mice helped alleviate the symptoms of what disease? You want to read again? Introducing the gene for a neurotrophic factor into the nigrostriatal pathway in mice helped alleviate the symptom of what disease? Nigrostriatal pathway, you are introducing a gene. Excellent answer. Okay. A gene located on chromosome 14 and involved with Alzheimer's disease all encodes for what protein? Alzheimer's disease, a gene which is located on chromosome 14, it is involved in Alzheimer's disease and it encodes for a protein. You have to name that protein. You got 27 seconds.
ApoE4.
Huh?
ApoE4.
Disease I am asking, not.
Alzheimer's disease. You are asking protein.
No. Okay, no. Okay, CAG is the genetic code for what amino acid? What amino acid? CAG is the genetic code for what amino acid?
Methionamine.
No, wrong. What did you say? No, it's a glutamine. Asha, the question which you have answered, I'll repeat again. Introducing the gene for a neurotrophic factor into the nigrostriatal pathway in mice. A gene located on chromosome 14 involved with Alzheimer's disease encodes for what protein? That is presenilin 1. Okay, that's it. Your time starts which one? F, no?
Yes, sir.
Okay. What are the triple screen and alpha fetoprotein plus tests?
All.
No, what are these tests used for? Okay. Right. Okay, we can give it to them. Prenatal test, screening test. Okay. Surgery to correct strabismus usually is performed during what stage of life? Surgery to correct strabismus usually is performed during what stage of life? Yeah, at least roughly you say. What stage? Any year, whatever you answer. Any clue you want to give? Okay. Okay, early childhood before the age of 4, that's correct answer. Okay? Alright. Tissue plasminogen activator is useful in the treatment of stroke because it does what? What does TPA do? That's the question.
Plasminogen is converted into plasmin.
TPA therapy in stroke, what it does?
Thrombolysis.
Dissolves the clots.
Yes.
You can give it to them? Okay. Unlike declarative knowledge, processing procedural knowledge requires what brain part? Processing procedural, that means motor. Declarative memory is temporal lobe, but procedural memory. Wrong answer. Basal ganglia. What do the letters stand for the GHB, a drug of abuse?
What? G?
GHB, it's a drug which is abused.
So we have to. Sir, can you repeat?
Full form.
Full form of GHB.
Gamma.
Loudly.
Hexobenazine, wrong answer. Anybody wants to tell? Bolo? You don't get any marks. Gamma hydroxybutyrate. Okay, that's the answer. So it's only next.
Hello, hello.
And answer clearly, because what happens otherwise, we don't understand whether you answered correctly.
Others will creep. Okay, your time starts. Magnetic resonance spectroscopy is related to MRI, but instead of examining anatomy, it examines what?
Blood vessels.
Wrong answer. It is a molecular composition and metabolic processes. Okay. Okay. Name the enzyme from an edible root that researchers can inject and be taken up by the nerve fibers that can be later identified under a microscope. You are extracting an enzyme from an edible root which researchers are using. They are injecting it into the animals so that nerve fibers can be identified under a microscope.
Pass.
Okay. Horseradish peroxidase. Okay. During development, the neural tube closes at about what week?
Fourth week.
Week 3 is correct answer. Multiple sclerosis is most common in what region of the earth?
Earth.
What region of the earth multiple sclerosis is common? Is it in India, Sri Lanka, London, or whatever it is?
The tropical areas.
It's temperate zone. Actually.
You told exactly opposite. Come on, next. Give her the
Name the receptor that glutamate and aspartate stimulate. You have already answered once, I think.
Receptors.
Excellent answer. Oh, that's it. Sir, very nice. Okay, that
Sir,
is
that neural tube closure.
wrong. Week 3.
But it's 28 days. 25 to 28 days, so it's.
The
fourth
judge is
week.
correct. No questions on that. Week 3. Okay, next. So we are going to. This is done. Now you want to tell the scores? Okay.
Before we start the next round, which is going to be a very interesting, the final and the make or break round, let us have a look at the scores. Team A is in the lead now with a total of 120 points. Team B is 70, Team C 60, Team D is 110, Team E is 80 points, Team F 110 points, and Team G is at 100 points. So the leader of round 2 is now behind, slightly behind in this round. So anything can happen in this buzzer round. Now please listen to the rules of buzzer round very carefully. First of all, I would like every one of you to press your buzzer one by one. When I say team G press buzzer, you press buzzer. T buzzer, it's working. F buzzer. Wait, Baba. Team D, press buzzer. Team C, buzzer. Team B, buzzer. Team A, buzzer. So all the buzzers are working. Now don't press, na? Okay, so now there are going to be total 10 questions. These 10 questions are going to determine the winner of this competition. Let me tell you a very interesting fact. Last year, this was the round where the winner team had tremendously scored. But this round comes with a catch. There are 10 questions. As soon as the question is uttered, As soon as the question is uttered, you have to press the buzzer. But there is a catch. If you press the buzzer and if you don't answer, or if you answer incorrectly, 10 marks will be deducted from your score. So all those who are here with trigger happy fingers need to be very, very careful. If you answer correctly, you get 20 marks. And the time limit for answering that question after pressing the buzzer is 30 seconds. 20 seconds. 15 seconds. ठीक है, 15 seconds. Within 15 seconds you have to answer. Okay, 15 seconds for everyone. It is non-passable. एक बार बजर दबा दिया, उनको -10 मिलने वाला है, उसके बाद में बाकी लोगों को चॉकलेट मिलने वाला है जो सही जवाब देगा उसको. तुम लोगों को भी मिल सकता है चॉकलेट, पर पॉइंट नहीं मिलेगा. Is it clear? Is it clear?
So it is MCQ type of question or
you'll see. You will see.
एक मिनट, टीम D's mic is not working. Please replace the mic for team D. Pardon me? I don't understand. Since you're not, you read the question.
मेरे को भी याद नहीं था वो सर्च पर मेरे को इंग्लिश याद आ रहा था.
Yes. People have done that in the past and we have allowed it. As soon as the question, if the examiner, if the quiz master is reading, if you have read it over there,
hello.
Everyone is able to read the screen over here. वो टीवी भी ऑन कर दो, वो वाला, वो टीवी भी ऑन करना है हमको. एक टीवी बंद है, वो भी ऑन करना है. सर एक मिनट, उसको बाद में कनेक्ट करेंगे, पहले यहाँ हम ऑन कर दें ना, उसके बाद में वो करेंगे. हाँ, और उसको ना पीपीटी पे लेके बी दबा देना आप, है ना. हाँ, पीछे जा रहे हैं. एक मिनट, पीछे से. ओके, यहाँ पर इधर से लगाएंगे उसको तो उनको दिखे. एक मिनट में ये नहीं दिखना चाहिए ना, यहाँ पर ये लगाते सर, वहाँ पर दिखने लग जाएंगे आंसर. तो इसको ना एक काम करते हैं ना, इसको भी हम यहाँ पर पीपीटी में कर देते हैं. पावर आ जाएगा, वो कहना सर. अभी हम इसको बी दबा देंगे तो ब्लैक स्क्रीन हो जाएगा, कुछ नहीं दिखेगा. लगाने दो उनको, फिर मैं बी दबा दूंगा तो ये दिखने लगेगा. बजर राउंड दिखेगा, अब यही दिखेगा और कुछ नहीं. वो टीवी नहीं ऑन हुआ है, वो वाला टीवी ऑन करो पहले, उसके बाद ही चालू होगा. Once everyone is satisfied that people are able to look either at this screen or that screen, you first tell me whether you are able to see. Everyone is able to see. Buzzers we have already checked. The rules I think are amply clear. Yes, they can press the, if you can read the question before the quiz master completes the question also, you can press the buzzer. But there is a caveat. If you press the buzzer, you have to answer. No answering or negative answering is going to give you negative marks. And as sir said that we are very lenient for giving 15 seconds. Ideally it should be 5 seconds. But since this is an undergraduate quiz, I think we can allow that much time. There is no passing. Passing is only for chocolate, but not for marks. Are the rules clear? And everyone is able to see on the screen? That screen also I want. That screen, main screen. Yeah. All the screens you can see. Some of you can see over there also if you are not able to see this screen. These screens are basically for C, D and E. F and G, are you able to see that screens? A and B, are you able to see the big screen? Okay. Sir, I hand it over to you.
Are they going to read or shall I read the questions?
You only read. If they press the buzzer, see, after pressing the buzzer, we are the spotter, we will say which team is going to answer. Yes. Although the buzzer is going to glow, only other buzzers will be silenced. But till then you wait. Okay.
Okay. Shall we start? Yes. Okay. Huntington's chorea is characterized by the depletion of what neurotransmitter?
GABA.
Team B, you have to answer.
GABA.
Okay.
Plus 20 for team B. Next question.
Gonadotropin releasing hormone causes the release of what hormones from the piteutary gland?
You have to answer.
Okay.
एक सेकंड ये फोन चलो ओके यू डू इट पक्का
Answer is correct.
Correct.
Answer is correct. 20 points for them.
Next.
Next question.
Name the part of the brain that covers short-term to long-term memory.
Team C. Team C, you have to answer.
Limbic system. Limbic system.
They have taken the chance. What did you say?
Limbic system.
Sir, they said
No, गलत नहीं है. They have to answer.
you answered.
Limbic
They
system.
are saying limbic system.
That's correct. See, if you are confident of answering any question, whatever is there, you work. That's up to you. See, you are science.
We can discuss it later. Right now, decision is final.
Limbic system. Okay, next. So, if anybody has so much confidence, you can press without me showing anything also.
Minus 10 is also there. Please remember that.
Okay.
Sir, we saw the answer. Narcolepsy.
No. This we will cancel this question.
Which one? Hippocampus लिखा था ना?
Sir, last question answer was hippocampus. They answered limbic system.
Exactly, sir. Exactly. The hippocampus.
See, hippocampus, limbic system are same. We'll cancel.
You have to specify the area. It is a part of limbic system.
No, limbic system.
Specific you have to tell.
Same.
Hippocampus you have to tell.
What are you said?
Limbic system.
What I feel is the meaning of the term limbic system goes for
Hippocampus is a part of limbic system.
although I agree that
Specify limbic system में amygdala है.
so the answer should have been hippocampus actually.
Yeah, that's right.
So you want me to?
Wrong.
Okay. Next. Okay, judge. That's why you call the judge. See, I am nobody to say.
So when you say limbic system, it means a large part and it controls emotions. Whereas the question was pertaining to specifically
Memory.
Agreed.
where only the hippocampus is placed alone.
Okay. So next question is audience question. Name the syndrome characterized by sleep attacks, premature entry, narcolepsy. हो गया? Okay.
Wait.
Okay. Next question. We are going to start.
टाइमर अभी मत लगाओ, बाद में लगाना जब क्वेश्चन हो जाए तो वो टाइमर की वजह से कंफ्यूजन हो रहा है. डोंट पुट टाइमर. वी विल टेल यू व्हेन टू पुट टाइमर.
क्या करूं?
अभी हम नेक्स्ट क्वेश्चन करेंगे.
Next question करना है? Okay.
No, that is not done.
What happened?
Sir, because that question was already seen.
No, I am not saying that. Shall I go to next question? That's what I'm asking.
We are going to.
Okay, next question. Amygdala and septum are part of this group of brain structures that regulate emotion.
Limbic system.
No, limbic system. Okay. No, I'm showing the answer only. I'm not going.
Now we can. So, okay, wait. Ready?
Yes.
Next question is going to come now.
Name the nucleus that acts as body's circadian clock.
Suprachiasmatic nucleus.
Yeah. All set? All ready?
Yes, sir.
Wait. Don't press. I will tell you when the next question is going to come. Yes, sir.
Okay, next question. Nicotine works by stimulating the same.
This one was before. This one was before.
They can.
It's okay.
Synaptic receptor site that are acted upon by neurotransmitter.
Acetylcholine.
Acetylcholine is the correct answer.
When we say next question, then only you can press, okay?
Next. You press my hand, sir.
Next question.
Sir, opioid. Sir, the opioid chemicals are endogenous opioids that the endorphin, dynorphin, and the enkephalins.
Yes.
Sir, if the sir, I had a doubt. Do we have to press the buzzer if you say next question or if the question is displayed?
See, if you are confident that whatever question comes, you are going to answer, or you are going to take the risk of -10, you can immediately press as soon as that question is announced.
I already told twice.
Wait and see the question, and then when you are confident, then you can press. Okay. It is a matter of your judgment. Okay. Clear?
Yes, clear.
Again, I am clarifying. All the children listen. Please listen once. If you have confidence, you can press the buzzer anytime after I say next question. But minus marks will be there. Okay? Is it clear? Okay. Next question. Name a cognitive disorder associated with chronic alcoholism. Okay. Right.
You just?
Okay. Let's go to next question. ठीक है बोला है उन्होंने प्रेस किया ना ठीक है name the monoamine neurotransmitter found in the raphe nucleus that is involved in any functions including temperature regulation, sensory perception and sleep. Serotonin is the correct answer. Ten questions हो गया? Okay, okay. Let me see if I. So B करो इसको मैं. I don't know whether I have it or not. I don't know. Okay. I'll try. If it is there, I'll do it. Otherwise, we'll have to make. Okay. Then I'll do something else. Next question. A new form of epilepsy treatment, electrical stimulation therapy, involves implantable pacemaker-like device that delivers small bursts of electric energy to the brain via what cranial nerve? That is a confidence. You want to read again?
Vegas.
Very good, excellent answer. I think that finishes the buzzer round and we come to the end of this wonderful quiz competition. We all enjoyed. Thank you all for the participation. Now
Please give us 5 minutes to compile the scores.
And most of the students request here so that we can have a photograph. It's very rare. Sripat, don't go. Dr. Sangle, madam, will you please announce Dr. Abhijit's name and his introduction, on whose name this year's award is being given?
Hello everyone. Now,
please silence.
I hope you have enjoyed this Neuro Quest. This quest is, the prize is actually was awarded in the memory of Dr. Abhijit Das Gupta. He happens to be my PG student and he was a very humble, very honest and very sincere and hard worker. After passing his MD medicine from BJ Medical College, he went to Delhi and he did his DM neurology. There he was a gold medalist and after coming back he joined Bharati Medical College as a lecturer in neurology. I
Hello.
In short time, as he was very popular in BJ, he was very popular in Bharati Vidyapit also, and not only with the faculty but also with the patients. Unfortunately, he died of cardiac sarcoidosis with multiple ventricular ectopics and BTACs. So it was quite unfortunate, but I am very happy and I am very thankful to Bharati Vidyapit Medical College to make a memory in the form of quiz. His father was very fond of him, and he actually was suggesting that we should keep, because he always used to take part in every quiz and he used to be a winner. So whenever this quiz is happening, I always remember him. So I thank Bharati Vidyapit Medicine Department as well as Neurology, especially Dr. Gorthi. When I just told him to start this quiz, he immediately agreed and he started this quiz. So I am thankful to Dr. Gorthi sir and his team for this wonderful quiz as well as for this award. Thank you, sir.
Thank you, madam. Thank you very much.
So as all good things must come to an end, similarly we are at the end of this quiz, and I am going to announce the scores. Team G Symbiosis has scored 100 points. Please give them a big round of applause. Team F AFMC has scored 110 points. Team E BJMC has scored 100 points. Coming to Team C AFMC, they have scored 90 points. And now let me begin with the third prize of today. The third prize today goes to SKNMC Medical College with a total of 130 points. They will receive a cup and a cash prize as well. Now let me go to the second prize. Any guesses who is second? सब बराबर गिनते रहते हैं उधर बैठ के. So yes, team A Maimar Medical College wins the second prize with 140 points. And I hope the cheer and applause you have saved it some for your own team, that is Bharti, which is the winner with 150 points. I would request Gorti sir to please propose a vote of thanks.
I think we have come to the end of this journey, this year journey. All the students have tried their level best to participate, and there will be many observations which are plus side, minus side, but it's all a game. So don't go with a disheartened heart from here. We are here to learn neurology, and we learnt a lot. We have sensitized ourselves. So I congratulate all the winners and also the participants who have come here from a long distance. I thank the Department of Medicine for their excellent cooperation. In this context, I request Madam to come and say a few words. Madam, please come. You have to address. She is the backbone of the whole quiz. She has to bless you all.
I would also request, please don't go. There is high tea and snacks waiting for you after the prize distribution. So please wait for prize distribution.
I must congratulate everyone, the winning team and all the participants and all the enthusiastic audience which is sitting here. And I would just like to say congratulations again. A very, very well organized quiz, I must say, and thank you, Gorthi sir, for this opportunity for everyone to present. Thank you.
Now the duty to acknowledge the participation of the whole Department of Medicine and Department of Neurology, all the faculty and residents. They have worked over long time to make it a grand success. Also thank the administrators from Bharati Hospital as well as the medical college for granting us this permission to conduct the quiz here. I will not be able to take the name of all the participants who have helped, but I am grateful to each and everyone for making this a grand success. And the special thanks goes to Dr. Nitin Gadkari, who is the one-man show for this. I think now we'll start the distribution of the prizes. I request Dr. Gargi to announce the prizes. And
good evening. May I call Dr. Diwan ma'am on stage to hand over medal to Team A?
But first is Team C.
I thought third, second, first ऐसे देंगे.
I can't believe it.
ओए, हमारे इधर आके देने वाले थे.
I can't believe it. Are you part of the way we've done?
We'll be handing over certificates to all the participating teams one by one. Please come on stage. Meghna Johnny. Meghna Johnny. Shifa Sheikh. Okay.
I am also.
Thank you, ma'am. Can I call on stage Dr. Rishi Patel, sir, to give the next two prizes?
नहीं बोल. Yes, she's our batchmate.
Kirti Dole.
What's your name? Vilas. Adore?
I don't think she'll be very 11, 12.
Mine. Even I was from mine.
Neha Joshi is next.
Which batch? Huh?
I didn't get your name again.
Sakshi Jairam.
Celine Raffel. Thank you, sir. Can I call on stage Prachi ma'am? Next participant is Rupika Pila.
Very pathetic.
I never went. Yeah. This is not the correct place to do things.
Vaikhari Bhumkar.
This is not okay. We got on the wrong foot. This is very bad. For very bad for sexual interaction and mental health.
I never went back to those classes. Even Gandhi, I never went back.
Thank you, ma'am. Can I call on stage Kavita ma'am, please? Kavita ma'am is left. Sujata ma'am, can you please come on stage to give the next certificate? Anusha Virkar.
I will tell you, I swore I will never go back. I never went back.
Krishna Sudev. Ishan Gokhale.
Huh? 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 No, I'm not.
Thank you, ma'am. Can I call on stage Shilpa ma'am to give the next prize?
You guys had very little time to prepare, like 3 weeks or so. Yeah, we had it at the start of the year.
Atharva Kulkarni is the next participant.
ये अपने ही लोग.
अच्छा कॉलेज में प्लीज क्लैप फॉर देम. We need to be clapping.
They're getting a medal for participating.
Aparna Vahegavkar.
Go from there.
Because when the results came, they changed colors. We should text. Yeah, and they changed colors so fast.
Next participant is Sakshi Jairam. Thank you, ma'am. Can I call on stage Sukanya ma'am to give the next prize? Swati ma'am, could you please come on stage to give the next prize? Advait Teli.
Orange color. This is not supposed to be.
Trisha S is the next participant. Ma'am, one more. Thank you, ma'am. Can I request Dr. Prajakta ma'am to come on stage? Next participant is Ishan Sane. Jessica Gupte.
लड़कों को ऐसा बाल पकड़ के ऐसा मारता है। ये तो लड़का है, बच गया लड़की।
Next one is Anish Lodha.
I'm telling you, I have a batchmate who never used to get marks in 11th, and this.
Thank you, ma'am. Can I call Sumit sir to please come on stage?
600 in it, and that day, मैं सब पढ़ रहा था, हमको कुछ नहीं मिला।
Next is Rajesh Bhavsar. Rajesh Bhavsar. Next participant is Paulomi Deshmukh. Sakshi Sharma. Next participant is Kritika Nathan. Thank you, sir. Can I call Dulari ma'am to give the next prize?
It was right next to Parva station.
Okay. At third position is team D. Can I call the participants on stage, please? They're from SKNMC Medical College.
You please. Third prize, right? Please introduce yourself again.
Hello everybody, I'm Jessica Gupte. I'm from SKNMC final year.
I'm Ishan Sane. I'm from SKNMC, same final year.
There is also a cash prize of 5,000 for team third position.
This you have to divide in between you two, Jessica and Ishan. Okay?
Second position is Maimar Medical College. Can I call on stage Dr. Gothi sir to hand over the prize? They win a cash prize. of 10,000. Thank you, sir. And sir, if you could stay on stage, we'll announce the first position. Dr. Pujari, sir, if you could come on stage to hand over prizes to team of Bharati Medical College. They win a cash prize of 15,000.
The cash prize is 15,000. You are justified in asking a party.
Thank you, everyone. I'd now request everyone to join us outside for high tea and snacks.
Please wait for the photograph. All of you, please wait for the, all come here. This much group. Madam, आइए please. आइए ना please. All the faculty also please come. Students. All the winners, please come. Come with your. We'll have a photograph. Your cups. Well done. Next time, better luck. आ जाओ यार, इधर आ जाना please. अरे please here. We are all waiting. All the prize winners, please come front. अरे बाद में करो ना please. Okay, please take the photo. Hey, come on here. Who is taking the photo?
There's a phone of green cover found if anyone has left it